So what has Unitaid done since 2006 for pediatric HIV? Well, it has been transforming the conditions of the market. In 2006, more than 400,000 children were born with HIV in developing countries, but it's only a couple of hundred in US and Europe. So for the pharmaceutical industry, a couple of hundred children in rich countries were not a market, and 400,000 children with no money and no ability to pay were not a market either. This is what we call a perfect market failure. And so we worked on that, and we changed the market situation. We estimated what the demand was, we pooled this demand, tried to see which countries needed treatment, which children needed it in priority. Then we worked with producers of generic companies to make specific pediatric drugs, then to put them in fixed dose combinations so that children wouldn't have to take a large number of pills. And we established a market for them. We put money into that and said, we are going to buy your products if they are cheap and if they can reach the children. And thanks to that, we have now more than 400,000 children on treatment. So what's the next step for Unitaid? Now that we have drugs for children, which are adapted, we also need to get drugs for the newborn, especially for a combination which is called protease inhibitors, which are very important for the future. Children will need these products more and more. And right now, they exist only in a solution of alcohol. It's just like giving a glass of whiskey to a kid in the morning. They hate it. It's extremely difficult for them to have it. Very often they vomit, they don't take their treatment. So what we have done is give a grant to DNDi to develop new formulations for these children with powders or microcapsules or sprinkles that could be adapted and that the children would be able to take for their treatment. So we need more children on treatment. Today is barely 30% on treatment. We would need many more. It is treatment which are adapted, and this is our work with DNDi, and it is enough money to make sure that these children remain on treatment and live a normal life.